Welcome to the presentation on residential care options. The intent of this presentation is to provide you information about available residential care options. There's a handout for this presentation with various helpful links. That handout will be referenced throughout the presentation and can be found in the notes sections of this video. As we age, many people need additional assistance and community supports to reside in the setting of their choice and maintain their independence. This additional assistance can vary from limited assistance with activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs, to 24-hour nurse care. ADLs include eating, toileting, bathing, grooming, dressing, transferring, and mobility. IADLs include taking medication, meal preparation and cleanup, shopping, laundry, and light housework. We will refer to ADLs and IADLs as daily activities throughout the presentation. Whether making the decision for yourself or assisting someone else, determining what care is needed and whether it should be provided at home or a residential care setting can be complicated and emotional. Although services can be provided at home that may allow you to stay in your home, this presentation will focus on residential care options. The goal is to be an informed consumer, to understand the differences between the various residential care options and ultimately select the best option for you. Being an informed consumer requires gathering information. To be an informed consumer, do your research. Identify your needs and wants to assist you when evaluating residential care settings. Needs and wants may include such things as proximity to friends and family, nursing care, provided meals, physical therapy, religious services, available hospice care, or special units for people living with dementia. Start your search using various sources, some of which will be detailed later in this presentation, to get information about services a setting may offer and whether it meets your identified needs and wants. Finally, talk to friends and relatives who have recent experiences with local facilities. Plan to make several visits. If possible, these visits should take place at different times of day and on the weekends. Further, you should request to see all areas of the facility that residents may use. Some examples of things to assess during a visit include: are residents' hands, fingernails, and clothes clean? Do staff show respect to residents, knocking before entering their rooms and calling residents by their names? Do all parts of the facility seem clean and well maintained? Does durable medical equipment like wheelchairs appear clean and in good repair? Do residents appear happy and engaged, taking part in activities, talking with other residents and staff? Does the facility support and promote cultural diversity and opportunities to display or participate in celebrations and traditions? Note that at certain times, visits and tours may be available in a virtual format. During the visit, ask the facility to provide a copy of its contract for residential care and analyze and compare the terms and conditions of the contract. Also, ask the facility for its policy describing the rights and responsibility of residents. Things to consider include services offered, building and atmosphere, social activities, population mix, food service, and resident satisfaction. Ask the facility to provide any resident satisfaction surveys completed within the last 2 years. You can also obtain information about resident satisfaction from some of the sources that will be discussed later in this presentation. Licensed facilities must provide a full list of costs and fees. Regardless of whether the facility is licensed, make sure you understand all the costs and fees and available sources for payment. This includes Medicare, Medicaid, commercial health insurance, and long-term care insurance. Use trusted and independent sources for information when you do your research, including state licensing websites for recent inspections and compliance reports, and the Centers for Medicare and Medicaid Services Nursing Home Compare Tool. Residential care settings can be regulated or unregulated. If a residential care setting is regulated, a state license is required to operate the facility. Facilities that are not licensed may look very similar to licensed facilities. Ask the facility if it is licensed, and then confirm with the Michigan Department of Licensing and Regulatory Affairs. Unregulated for this presentation means a state license is not required to operate a facility. Being unregulated does not mean you will receive substandard care or services, but merely that a state license is not required. Lack of licensing also means less government oversight. For example, no surveys conducted by the Michigan Department of Licensing and Regulatory Affairs. It's important to stress, though, that potential abuse, neglect, or exploitation should still be reported to Adult Protective Services, local law enforcement, and/or the Attorney General's office. The terms independent living and assisted living are not defined by statute or administrative rule in Michigan. These terms may be used for different types of facilities, including those that may be licensed. Independent living settings or communities are designed for older adults who want to live in a more communal setting and are mostly independent in their need for assistance with daily activities. Most commonly, independent living residents reside in apartments, condominiums, or freestanding homes. Individuals that need additional services and supports may be able to stay in the independent living setting and obtain those services and support through outside programs. These services and supports can be provided through the Medicaid Home Help Program, MI Choice Waiver Program, the Program of All-Inclusive Care for the Elderly, or PACE, or can be privately paid for. Services and supports can increase and change as needs of the individual change. So these options may be sufficient to support someone who remains in an independent living situation. Individuals may choose to move to another setting, however, as their needs change or because they face financial challenges remaining in their current setting. As mentioned earlier, the term assisted living is not defined by a Michigan statute or administrative rule. Like independent living settings, these settings or communities are typically designed for older adults who want to live in a communal setting. Unlike independent living residents, however, assisted living residents typically need assistance with daily activities. Adult foster care facilities and homes for the aged may be referred to as assisted living. Assistance may be offered for daily activities and social and recreational activities. Medicaid does not pay for room and board costs in these settings. Although room and board costs are not covered, services and supports may be provided through the MI Choice Waiver Program or the Program of All-Inclusive Care for the Elderly. While not all assisted living settings require a license, adult foster care homes, homes for the aged, and nursing homes must be licensed. Adult foster care homes provide 24-hour personal care, protection, and supervision for individuals with intellectual and developmental disabilities, mental illness, physical disabilities, or older adults who cannot live alone but do not need continuous nursing care. AFC homes are limited to no more than 20 adults. It's important to stress that these facilities may not have nurses or doctors on duty in the facility. This is important for individuals who may have conditions that require regular monitoring by a provider. While AFC homes do not provide continuous nursing care, residents may be able to receive hospice or nursing services from an outside agency under certain circumstances. Residents may also be able to receive services through the MI Choice Waiver Program or the Program of All-Inclusive Care for the Elderly. Each MI Choice Waiver participant can receive the basic services Michigan Medicaid covers, supports coordination, and one or more of the following services in the waiver. This includes adult day health or adult daycare, chore services, community health worker, community living supports, community transportation, counseling, environmental accessibility adaptations, fiscal intermediary, goods and services, home-delivered meals, nursing services, personal emergency response systems, private duty nursing or respiratory care, respite services, specialized medical equipment and supplies, and training in a variety of independent living skills. Homes for the aged are also designed for older adults who desire a more communal setting and may need assistance with daily activities. These facilities provide 24-hour room, board, and supervised personal care to 21 or more residents 55 years of age or older. As with AFC homes, a home for the aged does not provide continuous nursing care, but some of their residents can receive hospice or nursing services from outside agencies under certain circumstances. Also, like AFC homes, additional services and supports can be provided through programs like MI Choice and the program of all-inclusive care for the elderly. Nursing homes typically provide two types of care to residents. Short-term care. This type of care is provided to residents recovering from an illness or injury. An example is inpatient hospitalization. And long-term care. This type of care is provided to residents who are chronically ill or disabled and require long-term the level of services provided by a nursing home. Room and board costs and services can be paid for by Medicaid or by Medicare for a short period of time. Nursing homes are state licensed and almost all are federally certified by the Centers for Medicare and Medicaid Services. Nursing home residents have significant rights pursuant to state law and federal regulation. This includes protections against involuntary discharge. Residents may need to be transferred temporarily to acute care hospitals as care needs change over time. The Michigan Department of Licensing and Regulatory Affairs provides helpful information about selecting a nursing home. Also, the Nursing Home Compare tool displays an array of information about nursing homes, including whether a facility meets federal standards with respect to health and safety compliance inspections, staffing levels, and quality measure data. The next type of residential care option that we will discuss is referred to as either continuing care retirement communities or life plan communities. The applicable statute that covers these communities and the Michigan Department of Licensing and Regulatory Affairs refer to these communities as continuing care retirement communities. The industry, however, may refer to these as life plan communities. Continuing care retirement communities or life plan communities are campus-like settings designed to allow residents to age in place by providing multi-level residential options to their residents, including independent living, assisted living, adult foster care home, home for the aged, and nursing home services and facilities. These communities provide flexibility for residents as their needs increase over time. As a military veteran, you may be able to get assisted living, services in your home, or home health care through the U.S. Department of Veterans Affairs. You may also be eligible to live in one of 3 Michigan veteran homes. Contact information to find out more about the VA's long-term care program and Michigan veteran homes can be found on the handout. The following agencies are involved in licensing, law enforcement, and advocacy related to these residential care settings that we've discussed throughout this presentation. Contact information for these agencies is provided in the handout for this presentation. The Attorney General's Healthcare Fraud Division investigates and prosecutes abuse or neglect of patients or residents in healthcare facilities receiving Medicaid payments. This includes financial exploitation of patients or residents of such facilities. The Healthcare Fraud Division also investigates and prosecutes abuse or neglect, including financial exploitation, of patients or residents of certain residential care settings, regardless of whether Medicaid provides payment to the facility. In addition to contacting the Attorney General, you can contact your local law enforcement agency to report alleged abuse, neglect, or financial exploitation. Use the non-emergency number when you contact local law enforcement unless the report involves life-threatening and currently occurring abuse or neglect. Be as detailed as possible and include the basic who, what, where, when, and how, and include your contact information for potential follow-up. The Michigan Department of Licensing and Regulatory Affairs regulates many types of facilities and healthcare providers. The Bureau of Community and Health Systems within LARA provides oversight of adult foster care homes, homes for the aged, and nursing homes. The Bureau of Professional Licensing provides oversight of licensed individuals, including health professionals such as physicians, nurses, and social workers. And the Bureau of Corporation Securities and Commercial Licensing provides oversight of multi-level residential options, either called continuing care retirement communities or lifeline communities, and their contracts with residents. The Behavioral and Physical Health and Aging Services Administration within the Michigan Department of Health and Human Services provides coordinated services to Michigan's growing aging population. Individuals 18 years of age or older who are receiving Medicaid and reside in a licensed adult foster care home or home for the aged may be eligible for the Personal Care Supplemental Payment through DHHS. The Personal Care Supplement is paid to licensed adult foster care homes and homes for the aged. It is a legislatively mandated payment made for personal care services provided to eligible Medicaid beneficiaries residing in AFC homes or homes for the aged. Adult Protective Services, or APS, provides services to any adult who is reported to be at risk of harm from abuse, neglect, or exploitation, and where there is a reasonable belief that the person is vulnerable and in need of protective services. APS investigates abuse, neglect, and financial exploitation in AFCs and homes for the aged. APS, however, will only investigate in a nursing home if the incident occurred off-site from the facility or occurred within the facility by a non-resident or non-staff member. Also, if the resident's patient pay amount isn't being paid by the facility, this could be financial exploitation, and APS would investigate, as well as the Attorney General's Healthcare Fraud Division. Ombudsmen promote quality of life, quality of care, dignity, respect, and resident rights. Ombudsmen work at the direction of the resident and only with resident consent. The Michigan Long-Term Care Ombudsman Program advocates for residents living in nursing homes, homes for the aged, and adult foster care homes. Local ombudsmen located across the state make frequent visits to long-term care facilities and work directly with residents to resolve their problems and answer questions. Ombudsman services are free and confidential. Local area agencies on aging can help older adults seeking to maintain independence as they age. Mental health services Michigan are coordinated through local community mental health service programs. Disability Rights Michigan has broad access authority to monitor institutions and advocate for people with disabilities who live in them. Thank you for your time, and feel free to send questions or suggestions for future educational presentations to hcf@mi.gov.